All right. Well, welcome. Dr. Tay, do you want to get us started?
Sure. So my name is, for those of you who don't know me, I am Natalie Tay, and I am the chair of the Health Sciences Department, which has both the Health Sciences major as well as the Public Health major. And so we're really happy to see many of our public health majors on the call today or on the Zoom meeting today. And we are really excited to see so many other students who are interested in learning more about the public health field. And we want to welcome a few special guests tonight. And that is, I'm going to start in my order, Kelsey Kinderknecht, Alexa Morse, Scott Jenkins, and Carmen Ashely. And I'll let them introduce themselves today by themselves, but I just want to thank each of the four of them for coming today to talk about their careers in public health. And I would also like to thank Melanie Armstrong, Dr. Slining, Rebecca Marion Flesh for organizing this event today that hopefully will inspire many of you to think about your next steps in life. We hope it's in public health, but even if it's to get a better understanding of where you might fit in and how this relates to your future vocation. So welcome all, and thank you to all for joining us today.
Hi, everyone. I'll introduce myself. I'm Kelsey Kinderknecht, and I graduated from Furman in 2015. And I am currently in Seattle at the University of Washington in public health nutrition research.
And hi, I'm Alexa Morse, and I also graduated in 2015. I'm based in Atlanta and work for the Global Center for Medical Innovation.
Hi, everyone. I'm Carmen Ashely. I did not graduate in 2015. I graduated in 1996, and I am currently a branch chief in the Division of Adolescent and School Health at the Centers for Disease Control and Prevention in Atlanta.
Hey, everyone. My name is Scott Jenkins, and I graduated actually in 1994, which makes me the oldest, I believe, on the panel. And I am currently the Assistant Center Director for the Chemical Safety Sustainability Program at EPA in its facility at Research Triangle Park in North Carolina.
Excellent. Thank you so much. And you will get to learn much more about these folks in just a few minutes. I am Megan Slining. I am also faculty in the Health Sciences Department, along with Dr. Tay and many others. And it was really exciting to see all of these registrations come in for the event this evening. And I noticed that many of you maybe don't have a background in public health, which is very exciting to us. So I thought it might be helpful to start with just a brief 3-minute video on what is public health. Public health is really such a broad, interdisciplinary, multidisciplinary field. Of the panelists who are speaking, only 2 actually were health sciences majors. So we take public health needs people with all expertise and background. And so I'm excited to give you a brief overview of what is public health, and then we will get to the main event here in just one moment.
Public health is a vaccine that prevents disease.
Public health is a scientist who discovers the source of a salmonella outbreak.
Public health is outreach that helps prevent tobacco and drug use.
So what is public health? While a doctor treats individuals, public health looks at the health of a community. We research the risk of disease and injury in a population and take action to prevent them before they occur. Our early successes help stop the spread of infectious diseases by improving housing and sanitation. With a greater scientific understanding of health, well-being, and equity, we introduced prevention and early detection activities that helped increase life expectancy by more than 20 years.
Public health is access to prenatal services for healthy babies and moms.
Public health is safety advances like seatbelt laws that have saved millions of lives.
Public health is access to contraception and education to prevent sexually transmitted diseases.
Public health was founded on the principle of social justice. As a basic right, everyone should have the opportunity for good health. But today, improvements in life expectancy have slowed, and we do not live as long as people in many other countries. Did you know? Only a small amount of what affects our health actually happens in the doctor's office. In fact, our health is mostly determined by the social and physical environments in which we live, learn, work, and play. Forget genetic code. A zip code can mean a difference in 15 or more years in life expectancy, even if you live a few miles apart. Nearly half of Americans live in communities with unhealthy levels of air pollution, and the Flint, Michigan lead crisis taught us the dangers of our aging water systems. Poverty and poor health go hand in hand. Too many workers are denied a livable wage. They can't escape poverty and their health suffers. On-time high school graduation is a leading indicator of good health, but more than 20% of students miss this opportunity. Too many neighborhoods lack healthy, affordable food options like fresh fruits and vegetables. Addressing these complex health challenges will require cooperation across many sectors. Thankfully, public health has taken the lead in working with government, community organizations, and businesses.
We partner with city planners to design safe communities that encourage physical activity, bike paths, public transportation, and parks.
We support Medicare, Medicaid, CHIP, and the Affordable Care Act as steps to quality and affordable health care.
We advocate common sense measures to reduce gun violence. We can reduce gun deaths in the same way. We partnered with road planners and car engineers to address auto fatalities.
So what is public health? It is all of us, working together to make sure our communities are safe, prevent disease and injury, and give everyone the opportunity for good health. Join with APHA as we create the healthiest nation in one generation.
All right. Well, hopefully that gives you a little better idea of what public health is. It is so broad, and I'm excited that we have a panel that represents many of these things we just saw in the video. So the way this is going to work tonight is we have some prepared questions for the panelists, and then some of y'all have already sent us in questions. As you're listening today, if you have questions for them, please feel free to put them in the chat box. And then once we get to the section for student questions, we'll go ahead and call on students or alum who would like to ask questions if they want to unmute themselves and ask them directly. But without further ado, I would love to get us started. So, a question that I think is always interesting to our students and our young alum is, how in the world did you get from college to where you are right now? So I'd love to hear from each panelist. Describe briefly your pathway from college graduation to your current work, and any key milestones or challenges along the way. And if you care to share, did this journey line up with what you thought it might look like when you were at Furman? And I think we're going to start this one with Kelsey. Is that right?
Awesome. Yeah, I'll get us started. So when I think about this question, and specifically the latter part of the question, when I look back on my path, I'd say my path looks very logical, but when I've been in my path, it doesn't seem logical at all. And so I'd say I graduated from Furman with, I majored in health sciences. And while there, I got really interested in nutrition, but didn't know what that really meant in practice in terms of what does it look like to have a career in that in public health. And I'd say when I graduated from Furman, I knew I didn't want to go to grad school, but I didn't know what the next step looked like. And so I applied to a lot of things. I applied to internships, I applied to fellowships, I applied to Peace Corps, I applied to AmeriCorps, I applied to a lot of things. And I ended up, when I graduated, I still didn't know what I wanted to do or what I was going to do, and ended up getting a lot of rejections or not hearing from a lot of folks. And then got offered a position for Food Corps off of the wait list, I think in July after I graduated from Furman. So while at Furman, kind of was in a lot of unknown, and then decided to take this position with Food Corps. And so I worked with Food Corps in New York City for 2 years, and really worked in schools doing school wellness programming. That looked like being in the cafeteria, working on taste tests, and being in the classroom, teaching kids about cooking and gardening. It was a really fun job, really difficult. And I think we'll get to a lot of skills I didn't have going into that role, but really fun to develop that in that position. So following that, I stayed on with my supervisor and did like a monitoring and consultant role with my supervisor, evaluating food justice curriculum for teen and youth programming after school. And that got me really interested in research and how to evaluate programs and policies that are affecting public health nutrition and affecting health outcomes. And so that's what prompted my pursuit of a master's degree, and recently completed my master's of public health and my registered dietitian credential at the University of Washington in Seattle. And while there, have had the opportunity to work in research and been a part of several different studies, one on the Seattle sugary beverage tax evaluation, evaluating how that tax is working in terms of changing behavior on a population level around health outcomes and behaviors, as well as working on policies that are assessing the National School Lunch Program and how is that working? How is it changing kids' diet quality and health outcomes? And so I got really interested in public health nutrition research. How do we change population level health by evaluating policies and programs? And it gets me really excited to think about it and to dream big and ask big questions. So that's what leads me to today, where I think about my next steps, as currently I'm a research assistant, and kind of thinking about what does it look like to continue the career in research and having more jobs in the field, or continue with a PhD in that track as well. So that kind of brings me to where I am today. So thinking through it, obviously now that looks really logical, but in the moment there's been so many unknowns in that path, and cool to see how when you look back it looks logical, but in the moment it doesn't seem that way. So that's where I'm at.
Thank you, Kelsey. Alexa, how would you answer that?
So looking back at my time in Furman, I would have never predicted that I would end up where I am, at least right now. You can ask Natalie and Megan. I was completely lost. I knew that I loved science. I knew I liked helping people, but I had no idea what else that meant aside from a clinical career. And so typically the only thing to do is pre-med, but found myself discovering public health the end of my junior year and just deciding to go for a master's in that, even though Megan had me sit down and try to look at courses and figure out if that's what I wanted to do. But I was very stubborn, and I still am to this day. So I was very set once I decided to go get my MPH. During that time, did a lot of self-discovery as well, spent time working at the CDC. I was in the Division of Heart Disease and Stroke Prevention, which ended up being a little bit slow paced for me. So I took an internship my summer between my first year and second year of my MPH for a startup company, and fell in love with that side of things. So realized I wanted to be in the startup space, ended up working for a digital health accelerator program after that, which that's a program that works with digital health startup companies and helps them get access to capital and other things that they need access to. I got into another health IT company, and then 2.5 years ago, joined my current company where I manage our accelerator program and manage business development. I'm also getting my MBA in the evening as well, really because I found my passion is the intersection of public health, business, and technology, but definitely had a winding path, and there's just a lot of self-discovery that happens over time.
Thank you, Alexa. Carmen.
Megan, would it be okay if I shared my screen for a second? Oh, I know you disabled it, but is it possible to enable it?
I said, absolutely. Let me give you the power. Do you have it now?
I don't know. Let's see. And the reason why is because I do not want to, thank you. I do not want to bore everybody with 25 years of what I did post Furman. And I think it's just easier to show the answer than to talk about it. Can everybody see that? I have to do this at CDC. I did not do it for this presentation. I promise I'm not that overachieving by any stretch. you know, people talk about pathways. This is my public health journey. It's like a piece of wet spaghetti. I didn't have a straightforward line to anything in my life. I probably still don't. I'm still trying to figure out what I want to be when I grow up. But I thought I knew what I wanted to do when I came in at Furman in the class of 92. I was going to be pre-med as a biology major. I was going to go medical school at Duke University, become a pediatrician. And at the time, my boyfriend had received his appointment to the United States Air Force Academy, and I was going to marry him, and he was going to be a pilot. We're not together, among any other things. Life said, no, Carmen, no, that's not going to happen. So my junior year at Furman, I did an internship with South Carolina's Department of Alcohol and Other Drug Abuse Services, and I was assigned to a local drug prevention center. And that was my moment, my first milestone, where I was like, how cool is it to prevent things before they happen? Meaning, let's not get into the treatment part of things being a doctor. Plus, just honestly, I was lazy and I didn't do well in organic chemistry, but let's focus on prevention. And so that's where my trajectory first changed paths at Furman in my junior year. And then I was all over the place, and my bio says as much. So I worked for all of these different organizations, including the skull in the bottom center is a marketing agency called Brains on Fire, located in Greenville. Super cool agency. I was an account executive with their youth tobacco initiative. And then ultimately getting my master's at Emory, but then also working at Emory for quite some time after I graduated. So a lot going on. And I say all that to answer the question of no, nothing lined up. Nothing's ever linear, at least in my world. And I'd venture to say, in talking to students last year with this panel, it's the same for several of you as well. So Megan, thanks for letting me share my screen and answer my question that way.
Absolutely. Thank you, Carmen. Scott.
All right. Well, I'm not going to follow that very well. So my path is at least as circuitous as everyone else. I was a psychology major, graduated from Furman, and like I said, in 1994. Somewhere along the way in psychology, I decided I was most interested in sort of the biology, the biological psychology, neuroscience side of things. So I went to graduate school in behavioral neuroscience and got my PhD from the University of Alabama at Birmingham. I sort of left the behavior part of it behind, and I actually did I did my PhD research on intracellular signaling that goes awry in brains of people with Alzheimer's disease. And then from there, I went to Duke and was a postdoc in the Howard Hughes Medical Institute facility at Duke for a few years. And I was in the cell biology department and doing a lot of very basic developmental neurobiology. And at some point along the way, I decided I really wasn't interested in a career as a research faculty member at a university. So it would have been nice if I had figured that one out a little bit earlier, but anyway, it's better late than never. And so at the time I was at Duke, and I'll be quite honest, I didn't have a real interest in public health, the environment, or anything else, but I was looking for something different. And I happened to talk to a friend, a spouse of one of my wife's coworkers who worked at EPA, and said, hey, there's a big EPA facility here in North Carolina. They hire a lot of research folks. Maybe you should look into it. So I looked into it, and 3 weeks later, I had left Duke and was at EPA. I went in through the one of the research labs. So I went into what used to be the neurotoxicology division, and I studied basically the effects of drinking water pollutants on the development of the nervous system. From there, I moved from EPA's research side to the policy side. I worked for 12 years in the Office of Air and Radiation in EPA. And so I did a lot of science policy work on, if anyone's familiar with the National Ambient Air Quality Standards Program, it's the national standards for pollutants like ozone and particulate matter, nitrogen dioxide. So I worked my way up to a senior scientist level there, and basically led a lot of those reviews, including up until very recently, the most recent review of the particulate matter standards. And then most recently, I moved back to the research side of EPA, where I'm currently the assistant center director for the chemical safety program. We do work on pesticides and chemicals that end up in our food supply and drinking water supply through industrial processes or consumer products. So that, we focus mostly on health effects of those pollutants. So that's where I am. It's very, and I never have thought until very recently, I didn't think more than one step ahead in my career. So, you know, if you were to draw the line of my career, it would be similarly spaghetti-like. So.
Thank you, Scott. So much wet spaghetti here, folks. I hope that helps you maybe relax your shoulders just a little bit. I know there are a number of seniors on the call, and this time of year we start getting a little nervous sometimes as seniors, but hopefully hearing those 4 stories relaxes the shoulders, even if a centimeter would be helpful right now, right? So next question I would love to get some thoughts from the panelists on. What characteristics, skills, and abilities have you found to be important for impacting public health? Thinking about a group of folks who might want to be able to have an impact in public health, knowing that it is such a broad field. In your experience, what kinds of characteristics, skills, and abilities would be really helpful? And maybe we'll go with the same order. You ready, Kelsey?
Sounds great. Yeah, that's a tough question, but I think the first thing for me that comes to mind is teamwork. I think at Furman, I took several team-based learning courses, and I think that was starting to be a thing like right when I was leaving. And those classes were really challenging for me. I'd say one, because I had to rely on other people, and other people had to carry their weight. I think I was good at sitting in the back of a class and listening to a lecture and performing well on the test. And so those courses really challenged me. But when I started in my role in food corps in schools, the whole purpose of that project and that role was to build community buy-in around school wellness. And I couldn't do that alone. And so when I think about public health, it has to be a team-oriented approach in order to make any headway in whatever project I'm doing or we're doing. So that's one thing that comes to mind for me. And another thing that comes to mind is the ability to be flexible and be uncomfortable at times. I'd say my role in public health, initially when I graduated from Furman and was doing food corps in schools, I was told to teach kids in classrooms, and I had never taught before. And so being able to be uncomfortable and do something that I'd never done before and learn through that, I think is a key thing in public health, just because you wear a lot of hats and you're asked to do a lot of things that you might not feel like you're qualified to do, and be willing to kind of take it on and not be a perfectionist in that, and willing to fail and then learn from it and try again. So I think those two things resonate with me in the field of public health.
Thank you, Kelsey. Alexa, what might you add?
Yeah, first off, I completely agree with everything that Kelsey said. Those are extremely important points, and not just for public health. That's literally any career path that you decide to go into. Those are really important skills to have. I would add to that and say just a willingness to roll up your sleeves and actually do work. Some of the time, it's the best way to learn is if you're actually willing to take on tasks that a lot of people won't take on. And so, yeah, that's true for public health and any role. Again, also just recognizing that you can learn from everybody. So just because somebody comes from a different background, or you might be at a point in your career where you might be a higher level than somebody else, you can always learn from somebody. So just recognizing that as well.
Thank you, Alexa. Carmen.
Okay, no slides, I promise, but I do have a slide for this one actually. I'm gonna piggyback off of what Alexa said, because the first thing that came to mind is empathy. By nature, we are in public health, not private health, so we are serving the entire public, and there are people that we're going to come across who are not from the same backgrounds of us, not the same race, gender, religion, cultural identity, or whatever. And it doesn't matter. We are here to serve everyone. So we need to recognize those differences and appreciate those differences in order to serve the entire public.
Thank you. Scott, anything else you would add?
Yeah, I mean, I guess I think everything that's been said, I 100% agree with. The ability to recognize that everyone has something to offer and being able to kind of incorporate that into your perspective. The one thing I will say that's critically important, and I think I can't remember who said it, Alexa or Kelsey, the sort of a mentality of volunteering for whatever comes up, and oftentimes, especially as a new employee, you know, I found myself in situations where the available projects and tasks were the ones that nobody else wanted, and I volunteered for everything. And it's a great way to learn what you like and don't like. It's also a great way to do things that nobody else wants to do, and it gains you a lot of respect, and it can gain you a lot of respect and appreciation from your managers. So I totally agree with that. The one additional thing I'll mention that I have found extremely valuable in my own experience is, and I don't know if this is probably something, I don't know if it's how much of it is innate and how much of it is something that I've learned on the way, but it's sort of an ability to think about the problem that I'm dealing with and look to the end and say, okay, I know where I know where this solution needs to come out. And you know, while being a little bit flexible about that exact solution, you've got, in my experience, in order to work on a lot of public health is really messy. And in order to get from point A where you are to point Z where you need to be, you've got to have a sort of an end goal in sight, some sort of true north that's going to guide you where you can always kind of check your progress along the way. And I've found that to be incredibly valuable. And that when I'm in situations where you're on a project where that vision is not present, the projects tend to meander and not really get to where they need to be. So I would say a focus on, even though while you're having that flexibility and ability to be influenced by other people, you've got to have some end goal in sight that you're shooting for and always working towards. And you can change that end goal as you go if you need to. But you know, it's some, and I don't know exactly what to call it, some sort of vision, combination of like vision and you know, like planning, ability to kind of plan the steps to getting there.
So public health is messy, just like the wet spaghetti that gets us there, right? So maybe that pathway that gets us there is building skills to actually be successful once we are there, right? That's how we could pitch it, frame it for ourselves as we feel like we're on wet spaghetti. We're just building skills to be able to do public health work well. I think we have time for one or two more questions before we open it up to questions from the audience. I think this will come up later, but it's one of my favorite questions just to hear what people say. What advice would each of you have for students or alum who are considering their options? What do you wish you would have known when you were still at Furman, or maybe recent alum from Furman? What advice would you have? And I know we've already included some of this in the skills and capabilities, but a little more open-ended. What advice would you have?
I'll start us off. I think about what advice I'd say is reach out to folks. As much as the word networking gets thrown around, when people kept telling me to network, I was like, gosh, I don't want to go into a conference room and shake hands with people and like meet people, but learning what networking really is. And one, it's building relationships along your path, and then keeping in touch with those folks, and calling upon them when you need them. And then also organizations and companies that you're interested in, do research on them and reach out to folks. You can cold email people, and most likely, sometimes they won't answer, but sometimes they will. And if they will, and you can get a call for 15 minutes with them, it can be really valuable. And I feel like that's been huge in my path. One, to learn about public health and different opportunities, and also gain opportunities in different spots that maybe there's not a job posting, but there's work in that organization, and you just have to reach out and ask for that. And so that is, I think, a big piece of advice that I would have.
Thank you, Kelsey. Alexa, what would you add?
I'm obviously going to agree with what Kelsey said. I think that's actually a very important thing to do. And especially just to add on to that, while you're reaching out to people, I mean, you're a student, so take advantage of that. Everybody wants to help a student. I'm in an MBA program right now, and it's amazing the response rate I have now versus what I had when I wasn't a student. So seriously, take advantage of it. Um, Also, the other thing I would say is volunteer your time. So this goes back to being willing to roll up your sleeves, but that's how I've been able to learn a ton, is just volunteering my time and figuring out what I can do even outside of my day job to spend time with other organizations, and that's how I've been able to be exposed to things. Also, just with that, start saying yes to things. Especially if you have time, there's no reason to say no, and as long as it makes sense towards your long-term goal. But even if it might not make sense towards your long-term goal, is it something that you might be interested in? Can you learn a skill? Is there some sort of positive that can come out of it? So just say yes, and then at some point in your career you'll have to learn to say no. But that's later on. I'm currently working on that right now.
Thank you, Alexa. Carmen.
Yeah, I think this goes without saying from everything you've heard from all of us is don't ever feel like you're boxed into a particular path or a place. Let's always look for opportunities to grow. And if you want to explore this, explore this. If you are wanting to learn something new, learn something new. The second piece of advice I would give is join professional associations. American Public Health Association, which Natalie played the opening video for. Hopefully a lot of you are already part of it. Granted, they're expensive, but they give incredible discounts to students and early career professionals. But APHA, for example, they have tons of sections that pretty much align with any area of public health. And the sections that I'm involved with, and I think most of APHA, really try to cultivate student and early professionals and like to see them grow. I've seen throughout my time with my sections in APHA, several people grow into really high standing positions, both within that organization as well as in their own professional public health careers. So seek out professional organizations, whether it's public health related, evaluation related, health education, whatever your interests are, because there's a lot out there waiting for you.
Thank you, Carmen.
I think folks have said it pretty well. I don't have too much to add. I mean, my career has been an exercise in trial and error. So, the more you try, I think it helps you to really figure out, what you're interested in, what you're not, what you're good at, what you're not. And so do a lot of different things. And like folks have said, reach out to folks, do internships, do, interview, talk to people, and take whatever opportunities you have to reach out and try to figure out what other people do and what you may be interested in, because that's, there's no better way to learn than to just jump in and try.
Excellent. Thank you so much. Well, we have some time now for student questions. So if you, student and alum, if you would like to chat them to me in the chat box here, and then I can ask people to unmute themselves and ask directly if they want. I know many of you already submitted some questions, so I know you've got them. There's also the option to do the little hand raise, maybe. Nope, doesn't look like we have that on this Moodle, so that's okay. I have a first question. Eli, would you like to ask this directly? You're welcome to unmute yourself. Or I can ask it. All right, this is a question for Alexa. What is your long-term goal within healthcare innovation? What would you suggest in terms of learning about the field for someone who is still in undergrad?
That is such a good question. My long-term goals, I'm still figuring out. I think, eventually I would like to be running an accelerator program focused on digital health. Not sure exactly what that looks like, and that could change completely. To learn more, I can send you some resources, just websites to look into. We can also chat one-on-one offline if you'd like to, but just keeping up with industry trends, especially related to, so if it really is healthcare innovation that you're interested in, there's plenty of websites that I can send you that you can keep up with for news. And we can talk.
I'll put you in a breakout room.
Okay.
All right. What other questions do folks on the call have for any of our panelists? It could be directed to one panelist specifically, or generally to the group. We've had a couple of questions submitted before we got on the call today about whether y'all would recommend going straight to graduate school, going and getting your MPH right away, or taking some time off. And I know that we have all options here represented on the panel. So I would love to hear a couple of ideas. Carmen in the chat box says no, but I know others think so. Let's hear a little bit of the pros and cons of both of these options. Do you want to start us off, Carmen?
Sure, and that's totally biased. I don't want to, I think it's up to each individual person, but for me, that was not an option because I was in debt from Furman, not a lot, thankfully, but I was in debt and I was tired from studying all the time and I needed money for a job. So I worked a couple of years, but it also helped me get into graduate school at Emory, which is as competitive as Furman in a lot of ways, because I had experience under my belts and I got to meet a lot of people during the time that I worked. And it actually allowed me to grow as an adult at the same time. So I think, and there is quite the difference, and I'm going to be terribly honest, and I hope it doesn't come across in a negative way because it's not my intention, but in hiring in my role at CDC, I can see candidates who come in and they're just straight college academics and not having a lot of work experience in between because they come in incredibly intelligent and have all this knowledge, but they've not been able to apply it to the real world. And that is a disadvantage a lot. And a lot of times that becomes a negative in their placement as far as their position on the hiring stages, if that makes sense. So I think you can do both. So I actually worked and went to school with my master's, but I think you should just give yourself some breathing space if it's possible, or if you can't do that, then try to do, whether it's volunteer like Kelsey and Alexa have talked about, just try to stay engaged in some experiential opportunities while you're doing your academic work.
Thank you, Carmen. Alexa.
Yeah, I'll jump in because I went to grad school straight through. I think there are pros and cons to both sides. So going straight through, like Carmen mentioned, you have no real world experience, especially unless things have changed. Most people at Furman aren't working while they're actually in school at Furman. So you don't have anything really to apply it back to. That being said, a lot of times in public health, it can be, depending on what you want to do, it can be challenging to get a role without having an MPH. So it's a catch-22. I definitely would not recommend that you go to grad school unless you actually know what you want to do with your degree. I did not know what I wanted to do with my MPH, which I love my MPH. I would absolutely never take it back, but I'm back in school, which also I love going to school. But had I waited and really figured out what I wanted to do to take a next step, I don't know that I necessarily would have. If I had something else lined up, I probably wouldn't have gone to get my MPH right away. I keep going back and forth. That being said, I needed more growing time as well, I feel like. So that really helped me. And even during my MPH as a student, you can explore so many different things. And so you have this excuse to try out different things. You can do internships, you can be involved with faculty research, you can just be exposed to a ton of different things and learn through your coursework as well to understand more of what you want to do. I'll probably have more thoughts later on, but I'll stop right there.
I still remember one of your second or third semesters of your MPH, and you wrote me and you had 3 jobs and we're working on an additional research project. I was like, what in the world? It was amazing how much you were. So that was a lot of experience you got while doing your MPH, I know personally from you. Yes.
Yeah, I got to learn a lot for sure.
Yeah. Kelsey or Scott, would you add anything to the discussion on whether to go straight to graduate school or not? Scott.
Well, I can just say that obviously I went straight through, and so I had a lot of friends at Furman who really knew what they wanted to do when they graduated, and they went, and looking back, they went ahead and did it. And I was always extremely envious of those people. I sort of picked my way somewhat randomly through, and I did go straight through, and I ended up doing stuff that I probably wouldn't have done had I had more insight into myself at a younger age. And so you could make an argument that perhaps I should have taken some time off. On the other hand, you know, I'm happy with where I ended up. I ended up finding something that I really enjoyed. And so, you know, you can take I almost think I won't say it doesn't matter, but I will say that you can make it work no matter what path you choose. And if you find yourself on the wrong path, you can figure out a way to get yourself righted. I honestly, I think the most important thing is to go ahead and engage and start doing something, and something that you feel like is moving you forward. And if you feel like at some point that you're not moving forward anymore, you can rethink it. But, you know, just, you know, don't be afraid to take the step, even if you're not sure it's where you want to end up.
Thank you, Scott. Kelsey, anything to add?
Let's see. I didn't go straight into my master's, and I'd say for me it was the right move because I didn't know what exactly I wanted to get my MPH in. Like getting a master's of public health is so broad, and I feel like because I worked in schools and had I guess was engaged in that way, I then in class like would learn information and had schemas and places in my brain to place it. Whereas I feel like if I hadn't had that experience in such a broad course load, it would be hard to retain the information, I guess, if I hadn't had that experience. So it was beneficial for me, but I echo what everyone said, that it can be the right move going straight in or not, depending on what you want to do and what you know you want to do, I guess.
I know how to use a mute button. Again, I hope those shoulders are relaxing just a little bit, right? Here we have 4 people who are apparently happy with their choices, happy with their careers and where they are, and they went in different paths. So shoulders relaxing just a little bit more. What we're going to do now, I'm really excited about. We're going to go into some breakout rooms for about 20 minutes. And in these rooms, we've set up some breakout rooms for you, and you're going to have an opportunity to continue the discussion.